Hello everybody, and welcome to Species Specifics. Today we're going to be discussing camelids, so our alpacas, llamas, and potentially camels if you were to see those in veterinary practice. If you are new to this series, the goal of these lectures is to cover unique diseases of the different veterinary species that are specifically mentioned in the ICVA NAVLE study guide. I've also included some diseases that are not mentioned specifically in that guide, but may still come up on the NAVLE. The focus of these lectures is on disease recognition through images, clinical signs, and diagnostic testing. I've also highlighted key, easily recognizable characteristics in bold for some of the diseases. For our camelids, we're going to start with a few digestive disorders. First, we have gastrointestinal impactions. These typically occur due to either dietary indiscretion, phytobezoars, trichobezoars, or enteroliths. The major clinical sign of this condition is colic. These blockages typically have to be surgically removed to actually treat the condition. Gastric ulcers in camelids affect the stomach-like third compartment of the camelid digestive system. The main trigger for gastric ulcers appears to be stress for this species. Clinical signs include anorexia, bruxism, and lethargy. Treatment primarily involves reducing stress, as most of the medications we typically use for gastric ulcers in other species appear to not be effective in camelids. Gastric atony refers to loss of motility within the stomach. The cause of gastric atony is unknown in camelids. Clinical signs include complete anorexia and weight loss. Treatment often involves supportive care until the stomach begins to move on its own, and some patients may require transfaunation to re-establish the normal microflora within their digestive system that is lost due to anorexia causing microbial death. Megaesophagus is also fairly common in camelids, but has an unknown cause. Clinical signs include weight loss, postprandial regurgitation, and hypersalivation. Treatment involves feeding the camelid on a raised platform, as well as dietary changes to make swallowing easier. The long-term prognosis for this condition is quite poor in these animals. Now we will look at some congenital disorders. Choanal atresia refers to failure of the inner nares to open during development. This results in a blockage of the nasal passages, which is particularly significant because camelids are obligate nasal breathers. The main clinical sign of this condition in young camelids is respiratory distress. Treatment of this condition is not recommended, and many of these animals are euthanized due to their inability to breathe properly. Wry face is lateral deviation of the maxilla and potentially the mandible as well. This condition can result in loss of occlusion of the teeth so that they can't actually chew properly, as well as occlusion of the nares, preventing them from breathing properly. This condition may require euthanasia if the deviation in wry face is severe. Juvenile llama immunodeficiency syndrome is a genetic defect that affects both B and T cells in llamas. Clinical signs of this condition include weight loss, failure to grow, and persistent infections that do not respond to treatment. Typically, these animals are euthanized due to their poor long-term prognosis. Now we will look at a handful of other conditions affecting camelids that don't fall into the previous two categories. Copper deficiency primarily affects hair fiber quality and color. Specifically, it causes the hair to take on a kind of wiry or steel texture, and you may see loss of pigmentation along the length of the fiber. Treatment involves correcting the copper deficiency while still being mindful of copper toxicosis, which can also affect this species. Munge is a generic term used by camelid handlers for severe dermatitis that results in hyperkeratosis or formation of flakes and crusts. There are many possible causes, including dermatophilosis, ringworm, etc. Munge appears as adherent crusts, primarily on the paranasal and perioral areas of the camelid. Treatment involves managing the underlying cause, whether that be through specific topical treatments, systemic treatments, etc. Mycoplasma hemolamae is a blood-borne pathogen that can cause anemia in camelids. It is thought to be spread by biting insects. Many animals are asymptomatic, and they are only diagnosed when their blood undergoes a blood smear evaluation, and the veterinarian notices little dit dots within the red blood cells that are actually the Mycoplasma hemolamae pathogen itself. The main treatment for this condition is oxytetracycline. Berserk male syndrome is dangerous behavior that primarily occurs in male, human-raised camelids when they try to establish dominance over their human handlers. Behaviors may include charging, biting, or ramming the humans that are surrounding them. In some cases, castrating a human-raised camelid or an orphan camelid prior to puberty can help prevent this syndrome from developing. Finally, we have meningeal worm. This parasite is called Paralaphostrongylus tenuis, and it is a parasitic infection of white-tailed deer that can also infect camelids as a dead-end host. If infected, camelids develop severe neurologic disease due to the worms migrating through their meninges, and some animals may die. Prevention includes excluding deer from camelid pastures, as well as routine deworming to target the parasite. Thank you for watching Species Specifics. If you enjoyed this video, remember to like, subscribe, and to share with your classmates. Thanks again for watching, and we will see you in the next video.